Hi, team. These are some notes about the resilience PowerPoint that I hope you'll look at as you're working on the session that's provided for tomorrow, which is Friday the 13th. When you see slide 7, it's referring to Katie's Christmas. And I wanted to tell you about her family because Katie was a patient who was diagnosed with a big tumor on her leg 2 weeks before Christmas. And it was crummy. She was a 15-year-old soccer player, and Christmas is a terrible time to get a new diagnosis of cancer. What her family decided to do was just move into her room with her for the duration. She had 3 sisters. I guess she still does have 3 sisters and 2 parents in one small hospital room, and they decided to just cancel all of their Christmas plans, all of their parties, present giving, baking, mailing of cards, and hang out together in Katie's room. I think they played board games in there and watched television and laughed a lot. And afterwards, Katie said that was the best Christmas her family had ever had. Just lifting her up and her family up, I believe she is still on Earth. It was a story with a happy ending, and maybe the resilience of that family contributed to the fact that she's still on Earth. On slide 7, you'll see Blue Eyes White Dragon. I want you to go to the file also on tomorrow's session that is called Adrian's Dragon. Adrian was a precious 12-year-old I worked with, and he had osteosarcoma, a tumor in his shoulder. And he managed that for many months. By that I mean he was in the hospital a lot. He came to the playroom. His mom was a single mom, usually at work, so he was in the hospital on his own a lot of the time. And what he did to please himself in those hours was draw. Unfortunately, the tumor kept growing, and eventually it came to the time when he was going to have his shoulder bone and arm removed in order to stop the growth of his cancer. Now that's a terrible outcome, I thought, and I at the time had a phobia about amputations, and I don't think Adrian did, and I'm proud of that because my job was to prepare him for the amputation. And so I learned from nurses what we would see when the arm was removed, what it would be like under his bandage. And typically a caregiver, his mom, would have been there for the time when that bandage was removed, but she couldn't be, and so I was. Lo and behold, the bandage came off, and it was beautiful under there. It was kind of like the most wonderful sewed leather purse is the best thing that reminded me of. And he had some drainage tubes in there that came out after a few days, and it healed up pretty well. I told you that he was an artist before the arm was removed, and that was his primary arm. You know the word for that, when the one he writes with was the one that was removed. But the art I'm showing you, which is called Adrian's Dragon, is a piece of art he created 6 months after the arm was removed. He had told me before the surgery, when I asked him, "What do you think you'll do when your arm is removed? How are you going to manage that?" And he said, "I'm just going to keep drawing." So take a look and see what he kept drawing. Now slide 12 says who keeps going and who gives up. And that's a slide in honor of the mother of a little girl who had relapsed many times and had a cancer, I think neuroblastoma, but I'm not sure I even remember that. She was about 5 when the family got crummy news that there was no more treatment for this child other than keeping her out of pain. And she became a patient in hospice, and I did follow her family for a while. But before I followed them as a hospice provider, I was her child life specialist in the hospital. So I was there to see what her family did when they got this horrible, horrible news about her unstoppable disease. Her mother immediately, like that day, went home and rented a VW convertible. It was probably November, but she rented this yellow convertible Bug so that they could all drive around in it immediately in their neighborhood. And they made vacation plans. They bought tickets and went to Disney immediately, almost immediately. And this was the mother who had these amazing Christmas shoes. Both shoes were alike, except that one was green and one was red. And then she explained to me that she had those same type of shoes in her home with red and green because she had made special Christmas shoes to wear through the duration. This is an example of resilience promoting behavior. This is a mother who chose to use every single moment she could for joy, even in the last days of her precious one's life. So I'm honoring her and I'm sharing that great story for you. What I want you to look at on slide 13 is a little information to follow up what you've read by Edith Grotberg about helping children be resilient during disasters. I want you to take a close look at the information about I have, I am, and I can. And I'd like you to be thinking about what you have during this period of COVID-19. What do you have that will help you manage? What are you? What are the qualities you have? Think to yourself, I am. What is it about you that will help you manage this unusual and difficult, in some ways, time? And then I can. What can you do about it? This circumstance that you're in. What do you want to do about it? What will bring you joy during this time of an international global health crisis? And Harry Potter, the slide number 17, is put there in honor of a friend I had who was 21, 22 when there was no more treatment for him. And he was a young adult and he was not going to survive. And he and I had become close child life specialist and patient around the topic of Harry Potter. This is the patient with whom I discussed the last 3 Harry Potter books as soon as they were available. And in his last days, when I went to him and said, do you want to talk about dying with me? We both know that these are end days for you. How can I be helpful to you? And he said all he wanted from me was to talk about Harry Potter. So that's what we did. And his life goal was to live until book 7 came out. And he made it. And he got a special pre-ordered version of that book because Harry Potter was what he was focused on, even till his final days. So what a dear young man he was. And then you'll see on slide 20 about Danny, a patient who'd had a leg amputation. And in the playroom one day when it was really, we had some great music in there, and I looked at him and said, Danny, can you still dance even though you don't have 2 legs, but you do have those 2 crutches in your one leg? And he looked at me and said, if you can dance, I can. And so guys, if you can dance, Danny could. And if you can dance, this is a good time to be dancing. I'll be sending you more thoughts and joyful things, and we are resilient. We can choose to be. So rock on. I'll see you later.